Sorry about that. With Screencast-O-Matic, you only have 15 minutes, so I obviously ran over a little bit. Just keep that in mind because you'll be using the same interface when you do your presentations. But I want to finish up talking about the causes of death in which pretty much lifestyle plays an important role. So the last slide that I was on was the cause of death in which diet plays a part. So heart disease, cancer, stroke, and diabetes are the top, in which if you have a poor diet, you have an increased risk for these diseases. This next slide shows us the causes of death where inactive lifestyle or poor physical activity play a part. Again, heart disease is the number one, followed by cancer, cerebrovascular diseases, and then diabetes. The next one shows smoking. Again, heart disease is going to be on top, as well as the malignant neoplasms, which is cancers, cerebrovascular disease, chronic lower respiratory diseases, accidents, or pneumonia. And the last is going to be cause of death by alcohol. So again, many of the things that we've seen before: heart disease, cancer, accidents, suicide, chronic liver disease. So if we can modify the type of physical diet, alcohol, or smoking tendencies that you have, your risk for disease will go down. So I'm sure many of you are thinking, well, you're healthy, so how does this impact you? Well, even if you're healthy, you have to pay for healthcare costs that would go towards people who have these issues. And it may be due to these things such as diet, poor physical activity, their smoking, and alcohol use. So healthcare expenditure has drastically increased over the past few years. In the 1980s, healthcare costs were right around $12 billion. In 2002, that increased to $1.6 trillion, and in 2008, it increased to $2.2 trillion. So there's a lot of money going into healthcare costs to basically treat people on things that they could do for themselves. This is just kind of a newspaper clipping that talks about some of the different healthcare expenditures and healthcare payoffs, so that you can read these on your own. But the main thing here is that the United States spends more on healthcare per capita than any other country, and health spending continues to increase. So how can we basically modify this? What can we do to change the health expenditure and the healthcare costs within our country? So some different headlines that I'm sure that you've seen over the years. Big thing has been obesity, more heart attacks. It's tough to keep up on new health guidelines. Doctors are urging more exercise. So while we're trying to pour more money into this, are we really seeing the payoff in the different programs? So lifestyle as a health problem. According to David Stacher, former U.S. Surgeon General, over 50% of the people who die in this country die because of what they do or don't do. So for example, going back to those charts, do they smoke? Do they drink? Do they have a poor diet? Are they not exercising? He estimates that more than 50% of disease is lifestyle related, and a fifth is attributed to the environment, and a tenth is influenced by healthcare and the individual receives. Only 16% of disease is related to genetics. Thus, you can control as much as 84% of your vulnerability to disease and your quality of life. So just because your parents may be obese, or they smoke, or they drink, doesn't mean that you have to. And even being in that environment, if you can change those lifestyles, it doesn't mean that you could end up by smoking or drinking or being obese. You can change essentially your genetics. A healthy lifestyle habits should be taught and reinforced in your early youth. The choices you make today affect tomorrow. One initiative that I hope you've heard of, but is out there by the government, is called Healthy People 2010-2020. So they're done in 10-year spurts, and it's basically a prevention agenda for the nation. Every decade, the federal government identifies the most significant preventable threats to health and creates leading indicators that assess the health of Americans. The first goal is to help individuals of all ages increase life expectancy, and improve their quality of life. The second goal is to eliminate health disparities among different segments of the population. And then specific goals are listed here. And this is specifically for Healthy People 2010-2020. And Healthy People is basically about improving health. It's the health of each individual, the health of communities, and the health of the nation. However, Healthy People 2010-2020 goals and objectives cannot by themselves improve the health status of the nation. Instead, they should be recognized as part of a larger, systematic approach to health improvement. So everything goes back to lifestyle. So much of our quality of life, in addition to our quantity of life, depends on the lifestyle behaviors we choose. Our behaviors not only affect each of us individually, but they affect us cooperatively as a nation as well. We may think that the choices we make affect only ourselves, but the U.S. government also has an interest in the health of all Americans. A healthy population is the nation's greatest resource and the source of its wealth and strength. On the other hand, a nation that is not healthy drains the nation's resources and raises national health care costs. And then the last thing I want to touch on is the trans-theoretical model. You're going to use this as you do a 5-week behavior change project. And you need to pick a stage where you're in pre-contemplation or contemplation. But I want to review all 6 of the stages because outside of this class, whenever you make goals to go forward with your healthy lifestyle, you need to identify where you are in the stage to see if you'll actually stick to your goal or if you'll reach your goal very quickly or if you're already doing it. So the pre-contemplation stage is I can't or I won't. So you have resistance and you're unwilling to change the behavior you have within the next 6 months. The contemplation stage is you may. So you might consider changing in the future in less than 6 months. The preparation phase is I will. So you're gathering information and you're getting ready to change in the immediate future, less than 1 month. The action plan, or IM, is you're actively attempting to change. This stage requires the greatest commitment of time and energy. So now that you're in this stage, you need to focus on staying there and continuing to improve. The maintenance stage, or I still am, is you're actively living the behavior that you've changed by more than 5 years. By less than 5 years. And your termination stage is you've maintained the change behavior over 5 years. And that concludes our lectures on health and wellness. There'll be 2 more posted. One's going to be on a critical thinker, and the last will be on issue and topic. And then these lectures that have been posted over your first week will be included into your first test, which will be due on Friday. Thanks.